Well, I just want to say thank you for hopping on here today and talking with me. I am really excited about our conversation, and I'm really excited to hear about the kind of I don't know all the experiments you've been doing, all the things that you've learned, um,
Yeah,
and being able to hopefully bring this information to other people that could benefit from it. Um,
that's my my primary motive for doing this. So, and thank you for
yeah,
having me.
of course.
You said you wanted to talk about progesterone, right?
Yeah, so I mainly want to talk about progesterone. So where do you recommend that we start here?
Well, this actually ties in with what you actually expect from your HRT, I think,
Hmm.
because from our understanding or from what we observed in our community, uh, most girls did tolerate progesterone rather well. There were no issues with it.
Hmm.
However, there were a few cases, like a couple of them actually, where it actually did more harm than good. Some trans women have a certain gene that converts some of your P4 into DHT. So P4 being progesterone. And so DHT is dihydrotestosterone, and that's actually really bad for for everyone, I think,
Yeah.
post puberty. Yeah, so they experienced hair loss and even some facial hair growth and stuff like that.
Oh my gosh. And
Yes.
was that micronized progesterone or was that like methyl progesterone?
Okay, so about that, we actually don't really recommend anyone use like synthetic type of progesterone because the the natural kind is so available, and there's no point to use like something that's synthetic over something that's been proven to be effective and safe.
Yeah.
And the main difference, like nobody recommends this from you know all the people I spoke with, like endocrinologists, everyone said like don't take synthetic progesterone because it's uh, it's not good for you. And there is a risk of cancer associated with synthetic progesterone, but actually not associated with the bioavailable one.
Yeah.
So yeah, progesterone actually decreases the risk of cancer. I'm not sure if I sent you the study. Let me check real quick. Um, there was a European study that showed that women taking, of course, it wasn't done on transgender women, but rather cisgender women. But it showed that the chance of developing breast cancer, for example, is reduced when uh, progesterone is added to like HRT in
Yeah.
postmenopausal women. Yeah. So it's
Awesome.
actually quite beneficial for people who can tolerate it because there's also a chance you might develop like bad symptoms from it. Not really that you're gonna have a problem with facial hair growth or something like that, but just not tolerated. It might cause you bloating or I don't know headaches or some mood changes that you might not like. So we're usually recommending progesterone to anyone who can take it, who can tolerate it. And most girls like can tolerate it. It's a non-issue, and not even that they can tolerate it, but it helps them sleep better. A lot of girls reported better sleep, myself included, and it balances your libido. It gives you a healthier libido usually. But regarding physical changes, we haven't really seen like nothing that can be called conclusive, you know. But what I can tell you is that right now we're basically doing two experiments at the same time. We're
Hmm.
trying to stimulate breast growth in some kind of way other than what's been tried so far. And one of the ways is we're doing a few girls are doing bicalutamide as an androgen, an anti-androgen,
Okay.
and um, that coupled with a low dose of estradiol, basically.
Mm.
So I'm gonna get to the reason behind it and the mechanism, and some other girls are trying, myself included, some anti-diabetics coupled with it's a substance that basically makes you produce human growth hormone and IGF-1.
Mm.
Right now, the second group has really promising results. We all restarted our breast growth through the second.
Really?
Yeah,
And is this like the first of its kind, or are you replicating this from somewhere else?
we're actually like coupling two experiments together. That there are Reddit posts of girls who have tried this before, but there's no unanimous answer for it. Nobody can say if it actually worked or it worked just for them. So we're trying to do it on a larger scale than that to see if it's actually beneficial or not, and what are the side effects. Because
Yeah.
there are expected to be some side effects from this.
How is the experiment going so far? How far into it are you, and what results have you seen so far? Because that sounds really exciting.
Yes, it is exciting. Well, I'm actually a little over 1 month in. Um, and the results are 2 centimeters growth till
In a
now
month.
in a
That's a
month.
long month.
Yeah, that that is a lot in a month. Yeah.
How do
So
you feel?
it's interesting because I'm not sure if what I'm feeling like this unfortunately coincided for me with some other health issue I was having.
Mm,
So I'm not really sure if how much of this is related. I don't think it's related to this, but I cannot know for sure
yeah.
because the other two people who are doing this, because at at this moment there are only three of us because we
Hmm.
wanted to start small and you know not put anyone in danger or anything. And the other two people did not have this effect. Like I have a little bit of pain in my left leg, but and also like my liver functions are not well right now
How do you
because
know?
I've done tests, and I've
Mm,
also I regularly see the doctor and stuff. I do a lot of tests during these experiments we all do. So in case something does go wrong, we usually know about it. However, this coincided like with I have a congenital bile defect,
hmm.
and I've been having some problems with this over the past, I don't know, like a year or something,
Hmm.
and it kind of reached its peak, right? Like I don't know, 2 weeks ago or something. Yeah, and apparently that's how I found out, with the help of my doctor, who like he was kind enough to do some research on its own, that high doses of estrogen actually like can give you bile problems, especially if you have like congenital defects regarding this. So a word of warning for anyone who uses like high doses injectables and high transdermal doses, because apparently transdermal is the worst for bile problems. Yeah, even though it's the safest, like when you use it out of all the estrogens, but it
That's interesting.
it yeah, because it bypasses the primary like pass of metabolism, and
Mm.
so the substances that remain and go to the secondary pass are more likely to cause bile issues like increased acidity. Like there's actually three mechanisms of action here. I'm writing an article about this, but it's not, the research is not ready yet. I'm
Yeah. Do
gathering
you
as
have a
much
blog?
information. Hmm?
Yeah. So I guess my question is, have the other two people also seen the positive effects,
Yes,
or
yes. Also 2 centimeters growth in 1 month.
so this is
So
really sounds like a
really promising. Yeah, really
wow.
promising.
And is this
Exactly.
done in, like, I don't know, are there transgender doctors that would recommend this, or is, like, you mentioned that you're chaining together two different studies.
Yes. Well, uh, it's kind of hard for a doctor to recommend like a substance that's basically, to quote a friend, uh, an inverse chemotherapy, because it's practically doing the opposite of what chemo does to you, and that
What is that?
has um, well, because it's actually, it stimulates the production of growth hormone through a hormone that induces hunger in the body. So
I see.
yeah, because supplying like directly using growth hormone could put you at risk or of other stuff. So it's better to like make your own body, you know, regulated than, just inject human growth hormone. And yeah,
Yeah,
yeah. And the first one, I'm not sure if it's approved in the US though. It might. Yeah, it's actually approved in the US, but not approved in all of the European Union.
that's
Um, yeah, and I don't really want to say the name of the, substance yet, because we don't know if it's safe, and I don't want to really spread like
of course.
harmful, information. But this is also like a little bit, how shall I say it, like controversial, because um, it's been linked with bladder cancer, but there's not really, a definitive answer whether or not it causes bladder cancer, or how long do you have to be on it to increase the risk or anything like that. So right now we don't really know that. But from, it's an anti-diabetic medication, and from all the anti-diabetic medications, it's really easy on the side effects. So it doesn't really have any, bad side effects in most people. Like I haven't noticed any side effect other than a little bit of pain in my legs, maybe,
Mm-hmm.
and the bile thing, which I don't really think it's related, but I can't rule it out for sure right now. So yeah,
Yeah.
but that's promising. And the first group, we don't we suspect that it might only work at the start of HRT, going
The
through.
progesterone.
Yeah, no, it's actually the bicalutamide, because I'm gonna get to the
Oh, sorry.
progesterone because it ties into it. The bicalutamide and the low E dose. Because
Gotcha.
we've seen like we are trying to like tie in what's the thing in common that transgender girls with like good breast development had, and a lot of them were actually on bicalutamide for,
Mm.
at some point early into transition, at least.
Mm-hmm.
Yeah, so but then we asked ourselves, why don't all girls who are on bica, have you know a good breast development? And we think it's because the luteinizing hormone LH and FSH values, because usually, I mean, a lot of the times, people who take bica also take a pretty high dose of E,
Mm-hmm.
and getting a high dose of E actually reduces LH and FSH, and both of those have been linked to like an increased breast growth. There is a study actually with I'm not really sure what the condition is called. I can't remember, but like cisgender women who've not had a satisfactory breast growth, even though it didn't appear to be linked to genetics, had
Mm-hmm.
like really low values of LH and FSH due to various reasons. Yeah.
And that was cisgender women, you said.
Yes. cisgender women. So we thought, because actually what bica does is like, unlike other anti-androgens, because it blocks the receptors rather than the actual production of testosterone. So like your LH and FSH values remain high. It actually even boosts them a little bit. Yeah. So that coupled with low estrogen levels that couldn't uh, get those values back down might be a way to increase breast growth, but we don't really know yet. Like, we suspect that either you have to be on that kind of treatment for at least a couple of months to like see something happen, or you just you either start like that and then you get a good breast development, or like you miss your chance. We don't really know about that.
Yeah.
So, and now tying into like progesterone, like progesterone actually decreases LH and FSH. So if the theory regarding bicalutamide is true, then taking progesterone would actually mean that you're you know you're not giving yourself a chance to properly develop breasts. And there's like, have you heard of Dr. Will Powers?
I have heard of Dr. Powers.
Okay, so he had a theory like that you shouldn't take progesterone in the first few months, 6 months or so of breast development, and I think that might also tie in with this finding that it might be related to like LH and FSH levels early in breast development, like up to 10
Interesting.
or 2, I think, or 10 or 3. Yeah. So we also recommend girls like delay progesterone for at least 6 months, because there's no really any downside to it. So better be safe than sorry about it. So that would be my recommendation for everyone. Just delay it at least for 6 months, and then yeah.
Awesome. That's really interesting. Are there other medications that increase those levels that you mentioned? You said LH and
Yeah. Well, there is one other possibility that we know of, at least. Yes, apparently there are some medications, I think, but I'm not really sure about the safety profile of them to be used
gotcha.
in something like this. There's something that actually almost triples testosterone levels. It's a medication used in both women and men for fertility, and you can actually boost LH and FSH using that. And then theoretically, you could use bicalutamide to block the receptors. And but it's having like 3 times the normal level of testosterone in your blood might not be a good thing for
Yeah.
most people. So I'm not even sure how much bica you would need to take to block that amount of testosterone. In theory, it could work, but I'm not really sure. Like, we try to stay away from values that are like way off the normal range for you know yeah. And there's one other thing, like, um I think I was talking about earlier about there is a conversion gene
Mhm.
from uh from progesterone to DHT, and you could potentially, like, a few of us have did had blood tests done to see the DHT levels after taking progesterone. So you could
Mhm.
see if you have the gene or not. You could see the DHT levels. Unfortunately, it's on the expensive side, that type of blood work. So yeah, but shouldn't be like out of reach for most people. Like, a
Yeah.
lot of people could still be able to afford it. That's also a good thing to test. So if you're on progesterone for a month, let's say, and you don't want to wait for like 3 months to see if you get you know hair thinning or anything nasty, you could do that test and put your mind at ease that you're not converting it into DHT.
Yeah. So is that the only way that you would know? What are the other signs that you're somebody who progesterone just really doesn't work for?
I guess it puts you in a bad mood or depression, because for most girls, like it actually alleviates depression. So if you're one of those people who gets depressed, then maybe it's not for you. And also progesterone, like for everyone or almost everyone, causes like hair growth. Like it doesn't
Mm,
discriminate. So you get hair growth on the scalp, but you also get hair growth on the body. So your hair will grow faster. So you need to flex more, or you know. So that's a side effect that almost everyone has on progesterone.
gotcha. I I actually have a question for you. I just recently started progesterone. Um, and my first time taking it,
Congratulations.
thank you, thank you. So far, I think I'm in the group that it is helping. My mental health feels a lot better in the couple days since I started it, but it's only been a couple days, so I don't
No,
really.
it doesn't matter. It actually starts the first 15 minutes or something.
I felt it in my brain. I felt it right here on the top of my brain. It was the craziest thing.
Yes, it's really fast acting. So no, it wasn't your imagination. Like you actually feel it. Yeah.
What's the science behind that? Why did I feel it go into my like? It's like I felt it go up my neck, and then I felt it like sit on the top of my brain. Like, is that
Because
real? Or
like
did I make that part up?
actually my ex-girlfriend had the exact same experience described to me that you were feeling. So no, it's pretty common. Like I felt it. For example, I was I really have some sleep problems, and like the first after 15 minutes after I took it, I was like really sleepy. Like I couldn't keep my eyes open. So it helped me a lot for regulating my sleep. And yeah, but I think like estrogen and progesterone and even testosterone, like these are hormones that regulate a lot of other hormones. So it makes sense that you would feel it in certain parts of your body, because it has like they have such a wide range of actions throughout our body that like bone growth and fat deposits, and those are really complex things that you know affecting like insulin sensitivity of cells and stuff like that. Like the bile I was mentioning earlier, how estrogen affects the bile. Estrogen actually helps the liver in some ways, like, but it actually doesn't help the bile. So it helps you in some ways, but you know
Yeah, it hurts you in
harms
others.
you in others. Yeah, exactly.
Interesting. Are there other hormones that trans women could be missing on? Like, for example, if you don't take progesterone, you might be low in progesterone. It might make you depressed. Are there other things that you found, like with your group of people that are like, I don't want to
Um,
say ailments, but like, there's not a lot of research done for trans people, as you know.
yes, that's true. Yes, unfortunately, that's one of the reasons. Like we actually spoke with, because I'm not a doctor. I should have said that from the very beginning. I'm not a doctor, even though I was passionate about medicine since I was little. But I'm not a doctor. That's like a good disclaimer to be.
That is a good disclaimer.
Yeah. Um, we actually tried contacting doctors to help them make some make some studies. We said like, look, we're a community of like 30 girls that want to do some like help you do some research, so we could find out which things are true, which things are untrue. And most of even the like trans friendly doctors, out of all of them, just one was like open to this suggestion.
Really?
Imagine. Yeah.
Why so few?
We don't know. I guess people just don't. It's too complicated for us. For women, it's much easier on testosterone. Like you, you don't have to worry about so many things. Things are clearer for trans men, and I guess we also have doctors that refuse to work with trans women, just work with trans men, like with saying, "I don't want to deal with that."
Yeah. Do you think that there's a medical basis in that, or do you think it's just like trans misogyny, or just like people that don't really like trans women? I guess is it
Mm,
political or is it medical?
I think it might be a little bit of both, but in my experience, it's mostly medical because it's way too fucking complicated.
Okay.
Sorry about my colorful language, but it is. It's a lot. It's a lot harder compared to like trans men. So
Yeah. I actually reached out to my doctor as well, and because I was talking with them about cycling progesterone, which I am going to ask you about in just a second. But they said that there's not really any studies done. I would be curious to know the results. So I offered. I was like, because I go to a doctor that works with a university, I was like, if you want to organize a study, like I'm willing to do this. And I know a lot of trans women that would probably also be willing to cycle their progesterone for you as a study. And like you said, it's a no. As soon as you propose it, they don't want to talk about it anymore.
yes, exactly. Unfortunately, but we all we did find one who was willing to, and he also like validated our. We have we made a guide recently for trans women in Romania because we had nothing, absolutely nothing in Romania.
Hmm.
So really, it's not just about the language, because let's say the language barrier in Romania is really like thin. It's not a problem necessarily, but we have certain products here that you don't have in the US and vice versa, and it's really hard like to follow a guide from the US from in Romania. Yeah. So and he was actually really helpful in like reading through it and making sure like everything was okay, and our validated our test results and stuff. So yeah,
That's awesome.
it is. It's rare to see people from outside of community doctors who actually want to want to really help more than just accept you as your patient. Just go above and beyond that.
Yeah, it is really nice to have doctors that are willing to push the limits a little bit more and,
Yeah,
do more research into trans women, especially when the trans women are offering themselves as test subjects. They're saying like, please experiment with
please
with
experiment on me. Yeah.
yeah, and they're saying like, all the doctors are saying no, and it's like, why? It's my health. Please let me do this for the sake of other people that could benefit.
Yeah, exactly. I guess few of them understand what dysphoria does to us, because I was driven into some of these experiments by my dysphoria. So yeah,
Yeah.
I'd rather have a doctor like guide me other than do something stupid by myself. But unfortunately, we had no one at that point, so we decided to read up as much as we could. Yeah.
Yeah. It does seem like, unfortunately, a lot of us in the trans community have had to read the studies. We have to become our own doctors. We can't rely on the people who are supposed to have read the studies because
That's
they
so
don't
true.
read the studies. They just listen
That's
to
so
the other
true.
people that are spouting misinformation because they don't do enough studies. Oh my gosh. Frustrating.
Yes, and regarding that, like, can you imagine there's doctors in Romania who prescribe like full doses of Androcore, like 50 milligrams. You don't need like you only need a quarter of that, if that, to block testosterone effectively. Like
Oh my
at that
gosh.
yes, at that dose, you're giving depression, even more depression to depression to a lot of people who are already depressed. Not to mention the cancer risk, the meningioma risk. just
Yeah,
because you're not bothered to read a few studies.
and that's frustrating.
Yeah,
It's the health of trans people everywhere.
it is. And regarding what you asked me earlier, if there's any hormones or something that you know um, other people might have missed, or I think mm, applying transdermal spray or gel to like the scrotum is one of the best ways to deliver estrogen. Most everyone in my community, at least, is using that method because it's by far the most effective for us. It gives you more stable levels than injections, and it's less of a hassle. Like you don't have to, stick a needle inside of you or anything.
Yeah, that's generally pretty nice.
I posted some of my blood work. Okay, so
Yes.
these are my test results from using genital estradiol from like 158 milligrams per puff. So those are like four puffs, two in the morning and two in the evening, and those are my levels on 4 puffs a day, like 553
Hmm.
picograms per milliliter. Yeah, and the other ones are with 3 puffs. Unfortunately, like those test results, I remember were I waited a little bit more until I got to the to the clinic. So that's usually it's like 300 picograms per milliliter, but it was a little bit. And I'm not using any anti-androgen, so it's just monotherapy with genital spray. And I think this is the safest unless you have some bile problems, because
Yeah.
yeah.
What are your target levels that you shoot for?
um Actually, I've I wasn't above 200. So first of
Above,
all, let me start by saying it's above 200.
and that's for your
Um,
right estradiol above 200.
yeah,
Est-
yeah,
Estradiol.
estradiol, yeah, above 200, because at 200 you block like 90% of your testosterone. So like it differs from person to person, but you should take as much as you need to get your testosterone in a level at a level you're comfortable with.
Yeah,
So that depends. Like you know, I'm not gonna say which. Uh, Usually it's above 0.50, I think. Yeah, because below 0.50, because above
because
0.50, like there's masculinization starts to happen and stuff like that.
at 50 masculinization starts.
Yeah,
50 testosterone masculinization starts. 200 estrogen blocks testosterone.
yeah, blocks most of it anyway.
Most
So
test.
there might be girls who are fine. We have girls who are fine with like 2 puffs a day, which is around 200.
Hmm.
But you have to understand these levels are like the absolute low. They're they're taken like just before the next dose of spray. So our initial levels are actually much higher than this. Right
Gotcha.
after the dose, at first 4 hours, I think they're like, I don't know, 8 times higher or something like that.
Oh my
So they're
gosh. Oh,
really high. They're really high. Yeah. But it's the same for injections. Like if you test someone on injections, like right after they've done the injections, like
they'll
levels
have,
are
yeah.
exactly. So this is what we're using right now. We've had a lot of success with it. Nobody has had any side effects. Um, you should go if you want to go high. Like I wouldn't recommend you do it if you want to go, as high as you can. But if you really want to do it and you feel like you're so dysphoric that you need to like accelerate your feminization, because mostly it's all it does, it accelerates it. It doesn't, you know, give you features that higher levels don't give you features that otherwise you wouldn't. you wouldn't have. Just stay like go up to 700, but with the asterisk that your SHBG should also be like below max permitted levels.
What is that? SHGB.
Um, Sex hormone binding globulin. Like it's uh it's something that like takes your testosterone and your estrogen and basically like binds to it, and that becomes useless basically.
Gotcha.
Powers says that you should aim for like a 2% free estradiol to get the best results. So there's a calculator online because, for example, I can't even do like blood work to get to see my free estradiol levels in Romania, and it's in a lot of countries it's like that. So, but you can calculate it using testosterone, SHBG, and estradiol. I think having these values, you can calculate it online and get like a guesstimation of how much free estradiol you have, and the more you have, the better. So around you should aim at around 2%, but never go under 1% free estradiol. So either of these values get too high. Usually SHBG goes too high because
Hmm.
like the body sees like, okay, I have too much hormones, so I need to like protect myself and make them inert. So then SHBG goes up, and when that happens, like there's a misconception that you can going having too high levels of estrogen, of estradiol, like can make you like you know more masculine again, but that's a misconception. That doesn't happen. That only happens like the inverse of it is true. Like having too much testosterone can have it converted into estradiol, but not the other way around. So it's it's safe in that regard, but like I wouldn't be, knowing what I know now, I wouldn't recommend people like push it to the absolute max. I would say stay in a range you're comfortable with emotionally, stay in the range you're comfortable with, like with your libido and stuff like that. Yeah.
Awesome. Yeah. And then I was curious earlier. We mentioned it, but do you have you seen anything with progesterone cycling, or like cycling hormones at all?
Yes, I've been cycling it actually. Most of the girls haven't, but I've been cycling it because truth be told, like I absolutely detest the increase in the rate my body hair grows. So you know I'm taking it like, I don't know, around in cycles of 1 or 2 months at a time, and then I take
Mm,
a break because I don't want to wax every week, and
yeah. And
but
how is
that's
that cycling working for you?
it's fine honestly. Like from a you know in some ways, I'd rather be on it all the time because I feel better when I take it.
Mhm.
I feel like my libido is more uh, constant in a way. It doesn't fluctuate as much, and my sleeping is improved on it. So I really enjoy it. But yeah, at the same time, I keep pushing it off and say I'm gonna stay on it just in another year after my hair follicles have they're not as dense and stuff mostly.
Mhm.
So I'm probably gonna stay on it at some point, but for now I'm alternating it and mostly uh, I think it might also help my breasts, but I'm not really
What do you mean?
sure because um like in and of itself, I don't think it does much. But if you combine it with, if you take it like when your breasts are growing, I feel like it might be helping more then you not take it. But this is
Hmm.
the like just what I've observed and what other girls have observed, so we're not
Anecdotal,
sure. Yeah,
not
really
official,
anecdotal.
not a doctor, but anecdotally.
Exactly, exactly.
How does it feel for you mentally when you're on it versus off of it?
Oh,
So
I
it's
feel great.
month cycles.
I feel great when I'm on it. I don't
What
know.
is?
I feel more grounded. It's hard to explain. It's like, uh, I think I feel more confident also, but and I don't think it's really a placebo because I didn't expect much from it at first. So I just
Hmm.
noticed I was feeling like that, and then when I stopped it, because I didn't know it was from progesterone and my usual life events that I couldn't control necessarily, and when I stopped it, I noticed like, hey, like I don't really have that energy I had before.
Yeah,
That's something. I'm not really sure what it is. So
I've noticed that
yeah.
too. In the couple days that I've been on it, I feel more confident in myself. I also feel more motivated to do things.
Mm-hmm. Yeah.
A lot more motivation.
Yeah. I've experienced the same. So all in all, for everyone who can tolerate it, I recommend it. Like I think it's good. It doesn't if you don't take synthetic versions of it, you're not really exposing yourself to any risk unless you're over 65. If you're over 65, then progesterone might not be a good idea for you because it at that age it's been linked to dementia.
Oh, really?
Yeah,
Do
the
you know
on-
why?
not really. No, the only thing I've been buying it myself from the pharmacy. Nobody asked for uh, if you have a prescription for it. So, but I once asked my mom to buy me some because I was really occupied with something, and
Hmm.
she said that her like the pharmacist was really asking about prescription because she shouldn't take it at her
Oh,
age. Yeah.
interesting.
So yeah, but I guess like unless for most people like that's a non-issue.
Yeah. And for most cis people, they don't have as high of levels of sex hormones in their body at that age anyway, right? Like
Yeah.
menopause happens at 50. Old men lose their testosterone. Like old people just don't have as many hormones in their body, unless I'm misunderstanding.
Um, no, it's actually about postmenopausal women who are taking progesterone uh, after the age of 65.
Gotcha.
So that's an issue.
So
That's
it's
an issue.
65 specifically, not like post menopause.
Yeah, yeah.
That's
Post
interesting.
post the age of 65, but also all of them were on HRT and yeah. And the group that was on progesterone had a higher level of a higher incidence of dementia than the group that wasn't on progesterone.
Mm.
So obviously there's something there, but yeah, we don't really know if it's. I don't think there's a reason for young people to be concerned about, or middle-aged people to be concerned about. But as you age, it might be something to consider at some
Okay.
point. Any other questions for me?
Let me let me pull up this list that I wrote with all the studies and stuff.
Okay.
That's Cypro. That's a synthetic. You already said synthetics are not the greatest. Um, sounds about. Um, Sorry, I'm just looking. It looks like a lot of the studies that I grabbed where were me pointing out that they're just using synthetic progestins, and that synthetic progestins are bad and they have a lot of negative effects.
Exactly. And since we have access to like natural ones, like I see no reason why we should use synthetics. So that's
Yeah,
why we didn't do a lot of research on it, because we saw it as pointless.
yeah. So I guess one question I have actually is with this group that you're doing these studies with, are you guys planning any new experiments to try in the future? Like, what are your future goals, I guess?
We're currently like because this is probably gonna take a year or so.
Mm-hmm.
These two experiments were running in parallel right now, but I guess you know like a friend of mine really wants to do the, what's it called, aromatase, or how do you say it, like transforming testosterone into estrogen.
Mm-hmm.
Yeah, she really wants to try that, but I'm not really sure how many girls would like volunteer for getting high testosterone levels and transforming them into like estradiol. But
Yeah.
that would be like our own natural source of estrogen. So
How would you do that?
well, you would have to like boost your testosterone levels to a point where it gets converted into like estradiol, and then block the testosterone in some way. So the testosterone wouldn't like give you like masculine effects, and you would only get the feminine effects from estradiol. Now the
Yeah.
benefits of that is that you would have like luteinizing hormone and FSH in like normal values, or even above normal potentially, whatever that
Yeah.
means, because we haven't like reached that point to see. So
Would that mean that the testosterone is just like free testosterone inside of the body? Like if you took bica and a lot of extra testosterone to block the testosterone, but also have the high levels, would that just be like free testosterone? Earlier you mentioned free estrogen.
yes, well, actually, I think, yeah, you would have a lot of free testosterone in your body, pretty much.
That would be interesting to see if it is possible to like boost your testosterone for feminizing therapy as like a
Yeah,
different. You can either block your T or you can push more for your T.
yeah, that would be interesting. She also finds it really interesting. It's just that, you know, uh, we don't know if it works, and
Yeah,
I
yeah,
would have tried it early in my transition, but at this point, I'm not really up for trying that.
yeah,
So, so for any new people who want to, like, no, I'm just kidding.
yeah.
I wouldn't push anyone to do that, because we didn't even do like the whole research. Right now it's just an idea floating. Like it potentially could be done, but you know we're not even sure if it works, or if it doesn't kill you, or like nothing like that.
Or give you a heart attack or something.
Exactly. Uh, Apparently it's safe in the sense that it's it's prescribed to both like women and men,
Mm-hmm.
that pill, that fertilizing pill, but yeah, with no like really bad side effects or something.
Oh.
And apparently it's really effective in boosting fertility in both. It was initially designed for women, but then they realized that it actually works for men too, and they prescribed it
Mm-hmm.
for
Mm.
men too. Yeah, other than that, I don't really think we have like we're still testing that whatever we do differently than what doctors recommend are actually safe, because the genital application of estradiol that I mentioned before, like it appears to be safe, no side effects. All the studies that we read, even though a lot of them are like you know studies that that show that applying like estradiol genitally like reduces the risk of prostate cancer, for example, or testicular cancer. Yeah. So it appears to be safe or even beneficial in some cases, but we don't really know for sure because not enough people have documented it. So,
Yeah. So one question I have, you mentioned that was transdermal gel. Would like patches work the same way? The
yes,
like transdermal patches?
yes, we actually tested patches, but
Oh,
we found it was like too much of a hassle to like use patches in that area because they fall off easily. So you have to keep reapplying them.
I believe that. What are the other like recommended application areas for somebody with patches or, for somebody who, I don't know. If you can't do the best one, which is like you said, like scrotal application, what's the
Yeah.
next best?
The next best thing, I guess, would be like the thigh.
Thigh?
Yes, because it's slightly better than the arm. But I've even tried like armpit application
Hmm.
because that's supposed to be a lot better than both thigh and the arm, but like it had disastrous results. The results were the levels were even lower than the the arm application. So
Interesting.
plus it's really dangerous because you risk applying it directly to your breasts because it's really close, and
Why
applying
is
that
that
to
bad?
because there's a lot of estrogen receptors in your breasts, and if you apply like estrogen directly to those, being so sensitive, like you risk getting breast cancer.
Oh my
So
gosh.
that's a no-no. Everyone watching like should not apply, like unless the doctor suggests it out of, I guess, desperation. Don't apply like estrogen
Yeah.
to your
Last resort,
breasts.
don't do that.
Yeah, exactly. There are other ways, more even the anti-diabetics. I guess were uh, it's safer than doing that. So
Wow. Oh.
you know,
Well,
there's no.
hopefully we can see how that pans out. Hopefully that's the next recommended
We
trans
hope.
method.
We really hope. You know, because right now, as it stands, breast growth is really a problem for a lot of trans women. So we would like to not have to like uh, do implants and have natural breasts. So
Yeah, definitely. So there was one question somebody asked in the lounge chat. They asked if post bottom surgery, could you take a progesterone capsule as like a vaginal suppository?
depends on the type of surgery. As far as I know, only I guess both with colon graft should work, and peritoneal, but not the penile version, like the standard thigh method. That wouldn't work. So it depends on what kind of bottom surgery you plan on doing.
With PPT? I don't know what PPT means.
Uh, I don't know what's the abbreviation from. So if you can help me out with that.
They're typing.
Okay.
Per, peritoneal pull
Yes,
through.
yes, it works. It works.
Awesome. And then one other question I had actually, speaking of suppositories, oral versus suppository progesterone. Is there a recommended route? Is there a difference? Is it like the same?
Yeah, well, um, I can only tell you like the anecdotal evidence we have. So, um, we have girls who take it orally and who take it in suppository form, but like the ones who take it orally say it had, and we also have girls who took it like both orally and in suppository form, but the general consensus is that if you take it orally, then you get more of a psychological effect from it, and if you take it like in a suppository form, then you might have more physical benefit from it. So, but we haven't really noticed that. We've only noticed that it might have a less mental effect if you take it in suppository form, but we haven't
Y-
noticed any physical improvements if you take it like that. So we're not
Yeah.
sure, really.
What do you mean by less like mental effect?
Like we were talking about improved sleep, libido, and the girls have noticed that they're not as pronounced or at all when they take it anally. Because yeah.
Yeah. And what do they notice instead? Because you said they notice more physical effects. Is it like the increased libido? Like,
No, I was referring to like they didn't notice any breast growth from it or anything like that. Like
got,
only a reduction in mental effects, let's say.
gotcha.
But it might be possible. Like there are effects on your breasts, and we just didn't we didn't catch them because
Yeah.
so we can't exclude that for now.
Yeah. So that is somebody asked this question, and I'm wondering it myself. So is the whole thing about rectal efficiency of like processing progesterone? Is that just a myth? Is that just like a trans femme rumor?
Um, I don't think
Debate.
so. Actually, I don't think so because like logically, there's two like it skips the digestive path of your metabolism.
Mm-hmm.
So you're exactly like with I don't know if you know this, but there are pills that you can also like ingest. Well, you can also hold under sublingually, hold it under your tongue and have it absorbed like transdermally, basically. And
Mm-hmm.
there's different effects between like having it having swallowing it or like using it transdermally. Like the metabolism is different, and it's the same with progesterone, I think. So I don't really think that's a myth,
So
personally.
rectally would be like transdermal because it's melting in
Yeah,
your
yeah,
area.
in a way, yeah, in a way.
Okay,
Because I'm
that
sure some of it's like directly absorbed to your bloodstream, but yeah, that's transdermal. Yeah.
interesting. Okay, they're typing. So either way, transdermal or suppository is better than oral in theory.
I can't really say it's better.
Gotcha. It's just a different way. They both
It's a
work.
different way, exactly. It's different. We can't really tell if like you're gonna have you know better a better time using it if you take it like anally or if you take it like orally. It's we don't know yet, but there
Yeah,
it's different for sure. Like that we know that it's different.
yeah. So I heard from somebody the other day who told me that they cycle between doing it orally and doing it anally, essentially.
Yeah.
Um, is there any I don't know evidence that that could benefit?
Well, it's basically you're taking best of both worlds, I guess. So, uh, because you don't know if taking it anally does anything special, you're also taking it anally or and also taking it orally. It has like a half-life that it's just barely long enough for you to be able to do that. Because if the half-life is like really short and you take it like once daily, then it's never gonna build up. And
Yeah.
if the half-life is really long, like in the case of bicalutamide, for example, or there's another thing for finasteride, and I don't know the finasteride one, but I know the dutasteride one. That's like really long, months, I think. So that takes a really long time, for it to be to reach its peak plasma concentration.
Yeah. Do you know what it is for bica? You mentioned that that one's long.
A week, I think.
Gotcha. Oh
I'll check.
my.
I don't remember them by heart, but I do remember, ballpark.
Y-
7
Yeah.
to 10 days.
Wow. Yeah. So I guess the last question is just more of just like a practical question for anybody who, let's pretend that they're just starting hormone therapy. From what you've seen, would you recommend starting just estrogen and like bica? Like what do you recommend for somebody who's like,
Estrogen and bica. Yes. I've seen like good results on that combination, and a gradual increase in E. So never start with a high dose of E. That's my number one advice to everyone. Don't start with a high dose of E.
why?
There we're not That's my personal opinion, because if the theory is true, and like females in puberty, cis females, start with a pretty low E dose, and then they build up. And also there's like estrone to estradiol. How many parts do you have estrone to estradiol, like the fraction? And usually it starts, I guess, with something closer to 1-on-1 estrone to estradiol, but then as they go into puberty, like that proportion like changes, and there's a lot more estradiol than estrone. And we've also noticed that um, using transdermal, that proportion is like different by application method. So if you're using it on your arm or your thigh, then you get a lot of estrone, which is responsible for cancer, and it's generally not that good for feminization. But if you use it like genitally, then you get a lot more estradiol compared. It's like the proportion is 1-3 in favor of estradiol, whereas if you do it differently, I think it's like 3-1 or something like that. So it's a really big difference. Yes, if you
Wow.
use it like genitally versus the normal like approved ways of using it. So I would suggest, because cis girls in their early puberty have more estrone, I would suggest you start on your arm with a low dose, or on your thigh, and then you build that up to, like, I don't know, depending on if you're using gel or patches, and you just build it up to guess around 100 to 150. And when
Hmm.
you reach 100 to 150, then you would change to like genital application to get the same dosage, I mean. Yeah.
Gotcha.
and
So same
and stay
dosage, change where you're doing it.
Yeah, exactly. And stay around 100 to 150 while also taking bicalutamide. So you would start with bica, I guess, and then, slowly building up your estradiol levels. That would be my preferred method, even though I don't have like evidence to back everything up. From what I've said, it's just what I've seen that works and,
Yeah.
has potential.
And estrone versus estradiol, is that E1 versus E2? I
Yeah,
see other people say E1 and E2, and I don't
yeah,
know how to like
exactly.
place those with this. Is
Exactly.
E1 or is that E2?
No, estradiol, estrone is E1 and estradiol is E2.
So we want so E1. Oh, that's also when you take sublingual or if you swallow it, it gets
If you
converted
take
to E1.
if you take sublingual, oddly enough, you actually get pretty decent E2 compared to E1. So
But
that
if you
also works.
swallow it, you get E1,
You
right?
get E1. Yeah, a lot
So
of
that's why
E1.
you swallow it. That's why you want to take it. That makes a lot of sense. Oh my gosh, you just helped connect a lot of dots. Thank you.
You're welcome. Yeah, also there's another important thing that I didn't mention. So We mostly tested like transdermal stuff because we found it to be the most effective,
Hmm.
and it's also less harmful to your body. Um, you should also like swap like the place where you like use the patch or the place where you use the gel.
How come?
You shouldn't spread it on a big surface of your body. You should use like an area, I don't know, the size of a, I'm not even sure what to use it for comparison. So like the size of this approximately.
Okay.
There is a study which shows that actually spreading it gives you like bad absorption. And
Really?
yeah, and when, because that's weird because and a lot of uh, papers that uh, tells you how to use those medicine, uh, it says like you should spread it over a larger area as possible, as large as possible. And there are studies that contradict that, and we found that to be true. And also like applying it in a large area makes you unable to like change the area you apply it to, because you're already applying it like to an area as large as possible. And we found that absorption actually goes down in time. Like it takes months for this to happen, but it goes down, and you're gonna absorb less and less estradiol as time progresses. So
Even if
you're
you
gonna
rotate,
say again, please.
even if you're rotating the spots, or is that only if you don't
No,
rotate?
if you don't rotate, but if you spread it, you're gonna run out of places to rotate to.
Oh,
That's the
yeah,
issue.
that makes sense.
Yeah. So you're gonna end up with bad levels, and you're not gonna know why. We didn't observe this problem on genital application, and if there is a problem, like the absorption is so good that it doesn't show up in the test, so it's margin of error rate. But on applying it to our thighs and or our arms, like is really, the absorption was a problem. We had a lot of girls, we didn't understand, like they had like good levels after a month starting HRT, 2 months, 3 months, and then you would see a decline in levels, and it would get like really bad, like postmenopausal levels, even though they were using increasingly higher doses to like they couldn't even achieve the same results as before. So
Wow.
we also like encourage girls to like alternate even genitally, because we're not really sure if it helps or not, so we better stay on the safe side and just alternate as much as possible, even though the area is not that big.
Yeah.
Yeah.
And when you sorry if this is too graphic of a question, but when
No,
you
it's
say
okay.
genital application, does it have to be on the scrotum
On
directly,
the
or
scrotum. Yeah.
what about like on the like
We haven't.
I don't know the right word, like the prostate, the external prostate area, like right behind it.
um well, basically I think the only thing that matters is that you should have like I don't really know what this is called in English. Like the glands that generate sweat,
Yeah, like
because that's the pathway actually.
the estrogen goes in through sweat glands.
Yeah, exactly.
Wow,
So
that
that's
blew
why
my mind.
we tried like the armpit, but it didn't work. We don't know
Interesting.
why. Yeah, I only tried that, so nobody else did after they saw my levels. Yeah, we don't really understand. It was we I did it in the summer, so that might be related because I was constantly sweating, and maybe that would, you
Too
know,
much. Maybe it couldn't get
yeah,
absorbed. Huh.
summers can get really, really warm here in Romania. Like, so, yeah. Either way, we decided against it, also because of the proximity to the breasts. Because
Yeah.
I was even though I was really careful, I still like, you know,
It's very close.
yeah, it is.
Wow. Okay, sorry if this is random. Is it the sweat combining with the estrogen that lets it go in, or does the estrogen just like work its way into the sweat gland?
No, it gets absorbed into the sweat gland.
That's
So
so interesting.
you don't need to sweat. It's like, you know, yeah, it is interesting. We found a lot of you know, we were exploring some really exciting ways to like get better HRT, because what we were prescribed with were, you know, I was having low levels in the winter while I
Hmm.
was taking the advice of my doctor at the time, and I kept telling her like, look, I am having like chills. I can't get out of the house. It's winter. Like I was staying like, you know, I was really well dressed, and I was staying like 3 to 5 minutes, and I would start shaking from, you know, I had no hormones in me, basically.
You're just
I
going
didn't
through
know.
menopause.
Yeah, exactly. And I was basically the absorption thing happened to me, but I didn't know it, and she didn't know to tell me this. Like, and she would also say like, spread it out to a larger area, as large as possible, and
Oh
that
yeah,
proved to be
more
like
surface
incorrect.
area.
Exactly, that's incorrect.
What?
This is actually a slide from Wikipedia,
Oh,
believe it or not. So the information was there, but I don't know, for some reason, like everyone was recommending we spread it, and we did we're using a spray, but it applies to like it's transdermal, so either you use a gel or you use a spray. Like it doesn't really, you know. And this is we proved it right using blood tests. So
yeah.
when we didn't spread it, we had higher levels than when we did spread it. And as you can see, like even the drop off is not that bad, because you still get like a decent level up to like 12 hours.
Hmm.
So
Yeah. It looks a lot more effective, like you were saying, in as little of an area as possible.
exactly, exactly.
Oh my goodness. Oh, there's a question here. Hi, I'm not sure if this was already asked, but I read a study about how progesterone helps to mature breast tissue ductules to type 2. This is further matured to type 3 during pregnancy. Both of these types are more resistant to breast cancer than type 1. Apart from breast development, is progesterone as a part of female puberty from 1 year as part of the cycles going to be recommended for health reasons?
Um, yeah, actually, I did mention at the start that progesterone actually like lowers the risk of breast cancer.
Yeah, you did mention that.
So yeah, I don't know which study you're referring to, but I do know it lowers the risk of breast cancer, and I do know like in cis girls, like progesterone is actually not available at the start of puberty. So progesterone only takes effect. I don't know how much time after, but it helps like move like helps breast get into Tanner stage 4 from 3 to 4. That's that's what I know, at least. That's that progesterone has been linked to.
But yeah. And if I remember right, you said, you recommend it for everybody whose body responds well to it.
Yeah, yeah. I don't see any drawbacks to using it if you don't have the DHT conversion gene or any side effects from it. You can always stop it. Just I would recommend you like the delay taking it for at least 6 months, or you get some breast development, and then um I think Powers' recommendation is I did post that, by the way. Um, is like wait till you get to Tanner 3 and then start progesterone. So
Hmm. So it's less time based and more just like growth based.
Yeah, yeah,
Okay.
yeah. But we know that in the first like 6 months or so, most of the early breast development happens. So first 6 months are really important.
Yeah, after 6 p.m. Oh no, after 6 months, then you can add, not 6 p.m.
Yeah.
Yeah.
Well, 6 months is relative to like how is your breast development going, but it's around 6 months for everyone. I guess you should see which tenor stage you're in, and if you're in tenor 3, like then it's safe to use it.
Awesome. I guess I don't have any other specific questions, but do you have anything that I didn't ask you that would be useful for people to know that you want to talk about? Um,
Well, I did talk about like the dangers of for a little bit, the dangers of estrogen and liver issues.
mhm.
So that that would be like a good warning for girls who want to go into like high doses. Maybe you should have a health check first. There's a saying that with the more time you spend in transgender hell, the better your end transition will be. And I guess there might be some truth to that. Yeah.
What do you mean?
Well, because transgender hell like means to stay on a low estrogen dose, basically, and
Mhm.
that's been linked to being beneficial to breast growth in the end.
And that's why bica plus low estrogen plus
Yeah,
eventually progesterone.
exactly, exactly. Like, try to have patience, I guess, is my advice to everyone. Even though I know it's really hard sometimes, but being patient might, make it unnecessary for you to get implants later on, or I don't think it really affects anything else. I guess you know breasts are different in that way because it actually matters what we do. But I don't think like uh, it affects anything other than that. And also like I guess weight cycling. I recommend it for everyone, even though it's not a hormone or anything that you take, but
What do you mean? How do you do that?
Um, well, you have to lose weight to get rid of like your male fat pattern, and then
Hmm.
you gain weight to like replace it with female fat pattern. And the more you do that, like the more feminization like happens.
Yeah. So do you recommend that consistently or like for a specific period of time? Or like
Well,
is there
I
cycling is
would
no
say I would say if you can do it in a healthy way and not you shouldn't like gain weight rapidly or lose weight rapidly. You should do it in a healthy way, in a slow and steady rate. If you can do it like in a healthy way, then you should keep doing it. The more you do it, the better. Um, that is, if you haven't had procedures like um, fat transfer, because if you've had fat transfer done, that's not a good idea because it will mess up the procedure, because that fat will be consumed and it won't be placed back in your body. Yeah, but if you can do it in a healthy way, and you know um, myself included, I don't really think I can do it in a healthy way because I either like really gain weight or stop eating and really lose weight. So if you can do it in a healthy way, then I'd say like do it a few times, but don't go overboard with it. Just try and stay healthy, I
yeah.
guess. And also like yeah, I guess you know I'd say try to stay away from pills if possible,
Sublingual
because
estrogen
not
pills?
sublingual estrogen pills like taken orally. Try to stay away from those. If there's alternatives, like use those. Don't use pills, because there's no point in doing harm to your body. So try and stay healthy.
That's so funny because that's like against, at least in the US, they all start with sublingual pills. Or they all start with pills. Um,
With pills. Yeah. I know. They start with pills like is spironolactone still used?
it's still commonly used. Yeah. It's
Jesus.
almost the go-to, I think. I think you go, you get some.
Oh,
There's somebody in my server actually. I think they're in this call, they're listening, maybe, who they were prescribed Spiro but no estrogen.
wow.
Yeah. Yeah.
Wow.
So I think that a lot of the doctors here in the US have probably most doctors for trans care don't really know what they're talking about. They don't know what the best things for trans like the best medicine for trans people is.
No, they're prescribing a diuretic for like blocking testosterone, like in using doses that weren't really meant to be used. Like, admittedly, it's the practice is so old by now that they kind of know what bad things can happen, and it's mostly safe, but it's such a weak anti-androgen, and you like it creates a lot of problems. You have to watch your like potassium levels. You have to like go to the bathroom. Like, I was on Spiro, by the way. That was the first medicine I was prescribed. I was
Hmm.
going to the bathroom like 5 or 6 times a day. It was crazy, and it
Oh
never
my god.
really normalized. It never really normalized. I had to like change my schedule so it would, coincide with my bathroom schedule.
Yeah.
Nobody should
You said
live
it.
like that.
You said it never normalized. Are you still on Spiro? Are you still taking that?
Oh no, but I did take it for like 6 months, I guess, which is
And the
also a
effect,
big no-no.
and the effects stayed after, like still needing to pee a
Oh
bunch.
no, it didn't normalize in the first 6 months. I meant so
Oh,
like
that,
usually for a lot of for a lot of trans women, like the bathroom thing like becomes less of an issue as you stay on spiral. But for me, no, it didn't. So and
interesting.
also spiral might be linked to breast bud fusion, but we don't know for sure. It might
Oh,
inhibit
like
breast growth.
exposing.
So I don't really recommend anyone stay on Spiro. Like, you can use monotherapy if you want. Like, that's safer than taking Spiro.
Thank you.
And thank you for giving me the opportunity, to like to be here and talk about this, because
Of course.
yeah, I'm really happy if we can come together as a community, not just from the US or from Europe, or every one of us, and like put our minds together and try to like help the community be better and have access to better treatment and more information. And you know uh, I still see like girls who like take pills, so many pills a day, that they end up in the emergency room, unfortunately,
Oh my gosh.
especially in the like sex worker space. So because they don't have access to information.
Yeah. So thank you really for doing this work to figure out the information, working with the people that you work with. Thank you to everybody else who's, participating in these
Yeah.
experiment studies, and thank you to the one doctor who was willing to like work with you on this. I don't know, just thank you to everybody that's coming together to.
I will send this to the girls because especially a friend of mine, she actually found out most of this stuff out from reading Reddit, reading studies, and she was coming like, hey, this I was like, this coincides to what that thing I was thinking about. And like, she was instrumental in everything that we did and the experiments. And yeah, so she will be happy.
Yeah, I think that people doing things like what you in this group and these people are doing is I don't know. It's so important.
I
Because
think so.
big companies are not doing these studies. They're not doing the
There's
research
no
on.
money in it,
There's
I
not.
guess.
It's trans people doing it. So thank you for I don't know, stepping up to the plate, so to speak.
And thank you again. And thanks to everyone who asked questions, because and I guess if you have more questions, you can ask me in the chat, or I don't know if there's another specific topic in the future. Like, I'd be happy to like, talk about it and do this again. So
Yeah, that'd be awesome. Thank you so much. Um, were there any other questions? There's still people in here, right? Yeah, there's a few people in here.
don't think so.
Okay. Yeah, well then just, thank you again so much for coming on. I really enjoyed our talk.
Yeah, me too.
There was a ton of really interesting information that I may have heard before, or I saw it on Reddit, but I never was able to connect the dots, and you really just like helped bring a lot of that together. So just thank you again. I really appreciate it.
My pleasure. Okay.
Okay. Have a great day.
Bye.
Bye.